Why? Because it gives Canadians more choice.
Canada's Conservative Party is threatening to destroy the Canadian healthcare system by opening it up to more privatization if they're able to form government this upcoming election. So I'm going to play for you here a clip from Conservative leader Erin O'Toole. Then I'll get to my thoughts on what he's actually saying here, as well as thoughts from healthcare experts in what they see in his words. But first, here is Erin O'Toole discussing healthcare.
I view innovation as a good thing. I trust the premiers to do what is best for patients in their provinces. If Saskatchewan, Alberta, Ontario, or Quebec want to innovate to provide better health care, I support that. Why? Because it gives Canadians more choice. The more choices Canadians have in health care, the better. It reduces wait times, and it frees up more money to reinvest in health care.
This is incredible. I cover a lot of American politics, and Erin O'Toole clearly thinks that Canadians are stupid. If you follow American politics at all, follow the discussion around healthcare in the U.S., you always hear the words innovation and choice being thrown around. Oh, we should move to a Medicare for all system. No, Bernie's crazy. Bernie Sanders, he's a crazy guy. No Medicare for all. Americans need choice. Choice just means privatization, meaning it benefits the ultra wealthy. And I'll get to an example of that in a second. But first here, this from the Globe and Mail. The Conservative leader on Tuesday avoided the word privatization, instead talking about choice. Colleen Flood, Ottawa's University Research Chair in Health Law and Policy, said that term is often used as code for privatized options and can refer to two-tiered healthcare. Professor Flood said there's an important difference between private financing of healthcare, where individuals pay for a service and can jump the queue, and private delivery of healthcare that is publicly funded, which is used in many parts of the public system. The core issue for Canadians is wait times, Professor Flood said, and the evidence suggests that adding user pay options, quote, only solves the problem of wait times for the wealthy. Saskatchewan data show wait times went up since the policy was introduced in 2016. So I just want to address the last piece here. So obviously, yes, we all know, if you follow healthcare, the discussion at all, especially in the U.S., we all know that choice and innovation just means privatization. But this has been attempted in Saskatchewan. So they here in 2016 privatized MRI services to cut wait times. But data shows that MRI waitlist has doubled. So since they privatized the system, so they have a half privatized system. If you want an MRI, you can pay to jump the line and get an MRI. But at the same time, they have to ensure that at least 50% are able to get it through the public system. But instead of decreasing wait times, it's only increased wait times because it's only benefited the wealthy. So it's cut the access to MRIs in half for the vast majority of people, meaning longer wait times. But if you're incredibly wealthy and want to pay for an MRI to jump the line, then you can get one. This has led to a two-tiered system in Saskatchewan. And this is what Americans are all too familiar with. If you're wealthy in the U.S., you can have great health care. If you're everybody else, then you don't. Now, a little more on our healthcare system compared to others. So this is a recent study from the Commonwealth Fund that looked at healthcare systems across the world, mostly in developed countries, as you see here, and the U.S., of course, at the bottom of the list, but Canada, second last. Now, why would Canada be second last? Well, that's because these other countries do not privatize healthcare the way that Canada has. So there are aspects of the Canadian healthcare system that are, in fact, privatized. These countries, largely universal systems. So they are suffering less because they have true universal systems compared to Canada, where, yes, a large aspect of our healthcare system is public, but there are also many aspects of our healthcare system that is not public and, in fact, privatized. And this next opinion here on what Erin O'Toole was discussing shows that. So this is Canadian Medical Association President Catherine Smart discussing her thoughts on Erin O'Toole's words.
I think there's no question there's a lot of challenges with what we perceive to be universal health care. I think we have more of a universal illness system than we have a universal health system. And it's absolutely true that many aspects of care that people need to be healthy are not publicly funded. But I can tell you from my own experience that that is a huge barrier for people, not being able to access therapists, counseling, pharmaceuticals, dietitians, rehab specialists. These are things that keep people unhealthy. And my concern is us only making that worse.
Okay, so just last question on that. So when someone says, hey, we need to protect universal access, but we need more private-public synergies, at the CMA, does a red flag go up there?
I think it does because, I think that is one step towards a two-tiered healthcare system. And what we know from other countries that have gone in that direction, ultimately what it does create is two standards of healthcare, one for people who can pay and one for people who can't. So we believe strongly that our public system should be adequately funded to meet the needs of all Canadians, and that's what Canadians deserve.
So there you go. Another healthcare expert here discussing or exposing the fact that Erin O'Toole is just discussing a two-tiered system. He wants to move towards more privatized healthcare through innovation, choice, through the private market, which only benefits the wealthy. And she discusses there at the beginning of that clip what Canadians lack. So therapists, pharmaceuticals, dietitians, rehab specialists, long-term care is another one. That is why we rank second last in the world among these top countries in our healthcare system. It's because aspects of our system that should be public are privatized. And Erin O'Toole wants to move further towards that, which would put us further down this list, closer to the U.S. Now, let me show you reactions here from the other party leaders to what Erin O'Toole has said. On Tuesday, Mr. Trudeau said his government has made adjustments in the past to Quebec's healthcare transfers. Quote, we will continue to stand up for a public universal healthcare system. Unlike Erin O'Toole, in the depths of the pandemic, he actually shared his perspective that he believes in a for-profit private healthcare system, and he will not tell people what exactly he wants to do with that, Mr. Trudeau said. In a statement, NDP leader Jagmeet Singh questioned Mr. Trudeau's sincerity about preventing privatization within the healthcare system and accused the Liberals of not doing enough to address privatization in long-term care. Quote, if he's really against private healthcare, why does he let provinces privatize healthcare services? And why does he think it's good enough for our seniors, Mr. Singh said. So, great points all around. Trudeau, of course, is right to call out Erin O'Toole and his move towards privatizing healthcare. And Jagmeet Singh is correct to call out Trudeau and the Liberals not doing enough to expand and open our system. The Liberals have promised universal pharmacare for, I think, 25 years. They've been in power at least half that time and have not delivered on pharmacare. So there is plenty of criticism here of the Liberals in not furthering our healthcare system and expanding it. But at the same time, of course, Erin O'Toole is the biggest threat to our healthcare system. And I think this is the number one reason why nobody should be voting for the Conservatives.